This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning, everybody. So I was going to talk briefly about medications for atrial fibrillation. And first of all, what a difference from yesterday's crowd. I think there were 3 people here yesterday morning. So atrial fibrillation, if somebody has rapid heart rate, we need to kind of slow down the heart rate. And we have a couple options. There's a couple main options that we use, and those are either a calcium channel blocker, usually diltiazem, or a beta blocker, metoprolol. You can also use things like digoxin or amiodarone, but those are much less common and kind of not first line in most common situations. So, both diltiazem and metoprolol block the AV node and slow down the, conduction and can slow down the heart rate. There's a question of, which one do you use? Sometimes if somebody's already on one or the other at home, then it makes sense to continue that in an IV version because they're already on it and they've been shown to do well with it. But a lot of times that's not clear cut. And the question is which one's better. So looking at studies that have tried to figure out which one is better, diltiazem or metoprolol, there is surprisingly a small amount of data on this. You'd think, there's a very common thing that presents the emergency department. It'd be very easy to study. But there was a recent systematic review and meta-analysis. So looking at all the studies that were done, and there were 3 trials between 2004 and 2015 that had a total of 150 patients. So, you'd think you could get that here in 2 months, but that's what's been studied. And they looked to see which ones controlled heart rate better. And overall, diltiazem looked like it did a little better. At any point, diltiazem was about 4 times more likely to control the heart rate. And specifically, they looked at 22 minutes after giving the medications, 50% of the patients that got diltiazem had a normal heart rate, whereas only about 22% of the metoprolol patients had a normal heart rate. So, a little better for diltiazem. They also looked at safety in terms of, which one caused more drop in blood pressure. And they're about the same. They both, at about 15 minutes, were about 15 or 20 points lower on the systolic. So that's a good thing to know, is that we can expect the systolic blood pressure to drop by a little bit, but it's about the same in both. There's not, a huge difference. This isn't great data. Hopefully there'll be a better large study at some point. But overall, diltiazem might be a little bit better at controlling heart rate, but if someone's on one or the other, it's probably totally fine to use either. So it's not, a huge difference. Any questions? All right. Thanks, guys. Have a great day.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.